All right. Hello, everyone. We're going to get started. So, my name is Naomi Moturi, and I am the Adult and Family Program Manager here at Angel Foundation. And I want to thank you all for attending this webinar today in partnership with Open Arms. And I'm going to hand it off to Sarah Cohen to begin.
All right. Hi, welcome all, and thanks, Naomi. Thank you all for showing up this evening virtually to this presentation. We have this wonderful webinar series in partnership with Angel Foundation, and we're really pleased to present the three-part series to you. Just a reminder that the tonight we'll be talking about navigating the dietary side effects of cancer treatment. So we'll be learning about some common eating problems and how to adjust your diet to manage your symptoms. Next Tuesday, September 26th, at the same time, 5 p.m., we'll be talking about healthy eating and nutrition recommendations. So, talking about cancer fighting foods and how to maintain a healthy diet. And then the following Tuesday, we'll be doing a healthy meal cooking class. So, one of our Open Arms registered dietitians will be going over how to make an inexpensive and healthy meal. I will go ahead and get my screen set up here if you'll just allow me a moment to do that. Okay. Okay. Oh, sorry. I think I shared the wrong screen. Thank you for your patience here. All right. Okay, and Naomi, can you just confirm verbally that you can see my screen, please?
Yep.
All right, thank you so much. All right. Well, again, tonight we're going to talk about managing side effects from cancer treatments. My name is Sarah Cohen. I'm a dietetic technician at Open Arms of Minnesota, and I work with the registered dietitians at Open Arms. Joining on the call tonight is Shengyang Vu, another registered dietitian at Open Arms. We're going to be talking about as we're in the nutrition field, we're going to be talking about managing these side effects through food in the first of this three-part series. So we'll start by talking a little bit about the organization that we are with. Shengyang and I are here representing Open Arms of Minnesota. We're a nonprofit with two locations in Minneapolis and in St. Paul, and our service delivers medically tailored meals to Minnesotans, to folks in our community who are managing serious illnesses, and also to their loved ones, their caregivers, and dependents. Um, in addition to providing the food itself, we also offer nutrition and education and counseling to our clients to help support them through whatever side effects from treatment they may be managing, or any other aspects of their health or wellness, or as they move through their illness. In addition to serving clients with cancer, we also serve folks who have illnesses such as HIV/AIDS, ALS, or known as Lou Gehrig's disease, MS, congestive heart failure, COPD, and end-stage renal disease, where they're receiving dialysis. And again, we provide medically tailored meals appropriate for managing those health conditions through our services. For folks that are in our delivery area, we are able to deliver generally weekly meals directly to our clients' homes. So, taking some of the burden off of going out to get groceries or other food related items. Our typical delivery is 14 meals worth each week. And we have our delivery is sort of in two different packs. One, which we call lunch, is something of a hybrid of fresh and frozen items. And the other pack is a dinner pack, which is just frozen items. Some of you who are joining us tonight, this evening, or who may be listening to this may already be clients of Open Arms. I'm just going to spend a moment to talk about how, if you're not on our services, how you would get on our services. It starts by submitting an application. There's two parts of that application. One, which the client fills out with their demographic information, provides us some information about their um, care team providers that we should connect with, also just signing waivers, release of information. And because we serve medically tailored meals, we also obtain a part of the application from a member of that care team, whether it's a doctor, nurse, registered dietitian, social worker, medical case manager, and so forth to verify that medical status. Um, in order to, as part of the process for onboarding, as soon as when we receive a completed application, one of our client services members reaches out to the clients to complete that intake call. Generally, the first delivery is within about 2 weeks from that onboarding call. In certain cases where there's heightened nutritional risk or other factors where an expedite is requested, we may be able to provide that on a case by case basis. And then we do have periodic recertifications, so either annually or semi annually, in order to obtain updated information about health and medical status and get any updates as to medical status. Here's information about Open Arms on our website, reaching out to meals at openarmsmn.org, or contacting our client services team at the phone number on this slide here, with any questions about our services or getting on services, eligibility, and so forth. All right, and now we're going to get into the meat of our presentation here, talking about common eating problems during cancer treatment and some food-related tips to help manage those. Uh, if you are, in whatever stage of illness or during cancer treatment, it's talked about by many care providers, the benefits of getting good nutrition throughout the process with cancer treatment, maintaining strength and energy, just maintaining your body weight and store of nutrients. We also know that good nutrition during cancer treatment helps reduce hospital stays or the length of stays in the hospital, as well as hospital readmissions. Good nutrition lowers the risk of infections and also helps those going through cancer treatments better tolerating the side effects of their cancer treatment. And we'll get into more about that. Good nutrition also helps prevent any delays or breaks in treatment so that the treatment can continue as scheduled and be most effective. And also provide good nutrition also supports how well the treatment works and those treatment outcomes. Once cancer treatments are complete as well, we also see faster and more complete rates of healing and recovery with that good nutrition in place. So just talking a little bit about, the why. One thing I do want to take a moment on is that during receiving a cancer diagnosis, undergoing treatment, it produces a lot of emotions. Those could include feelings of depression or anxiety or anger. Um, Feeling those emotions and going through that, you are not alone. Many other people, I would say most people, undergo some kind of emotional um, progression through at least some of those emotions. And in talking about different side effects you may be experiencing, and how that relates to eating patterns, motivation, and energy to shop and get groceries. The emotional impact of that certainly is very, very real and very much a part of that experience, and impacts eating as well. And just taking another moment to talk about managing those feelings, those very normal and common emotions. Just thinking about a few ways to um, work through those, whether it's speaking with a professional or just gathering with family and friends, finding opportunities to do activities and experience movement and foods and that you enjoy, and getting adequate rest where possible. So, the emotional side also has an impact on your well-being, as well as some of the side effects that we'll be discussing today. Um, Also, that last point, in managing the feelings that you may have experienced or be experiencing as you move through managing cancer, is one of the ways to cope with that is to learn more, to gain that knowledge. And that's exactly what we're doing here today, to be able to give you some information, help you prepare and know what to expect, and gain back those feelings of control. Many times in managing a health concern, there's a feeling of lack of control, so that gaining some education and some knowledge, feeling better prepared, can help you um, get back some of that sense of control. So that's part of what we hope to accomplish here today, is to empower you with some information and some tools for moving forward. Um, all right, and this is a summary of what we'll be discussing tonight. Not all, or sorry, not all eating problems that one may experience during cancer treatment are listed here. There may be some others not on this list that you or your loved ones have experienced or may be experiencing at this time. And it can range from multiple causes, from the cancer itself or cancer treatments, where that cancer is located, and what area the cancer is targeted to be to reach. They can also come from medications, infections, pain, also changes in activity, eating habits, sleep patterns, and those emotional impacts that we mentioned earlier. One of the important things that will provide you with more information about your symptoms, and also be a great tool to speak with your care team about, is to track those symptoms as you experience them. You can do that in one of a couple ways. You can do the good old pen and paper with a symptom diary. So tracking what foods you're eating and how you feel. If you may be more tech savvy and prefer to use a symptom tracking app, these here are a couple ones that we've found that are free to use, and um, available to use if that works better for you. Um, and it can be, again, a really important tool to um, know what you're experiencing, to kind of also, if your treatment moves through certain cycles, to know what to expect as you move through your treatment based on what you've experienced before. Another benefit of using these tracking tools is that you have that record to share with your care team, and you and your doctor can work together to manage some of the symptoms you're talking and, or I'm sorry, some of the symptoms that you're experiencing, and talk through ways to better manage those. The first symptom that we'll be talking about is fatigue, probably the most common side effect of treatment through cancer. This is where you're feeling significantly tired, really tired all the time, where you don't feel better or recovered after resting. Again, very common side effect of treatment. Between 80 and 100% of people experiencing or undergoing cancer treatment report feeling some symptoms of fatigue. And this you might describe as feeling drained or washed out, perhaps feeling slow or sluggish. And these feelings of fatigue also might go in cycles through your treatments. So perhaps a day or two after following your treatment, you're really feeling fatigued, and then emerging from those first few days after your treatment, you may gain some energy back. So it may move in those kinds of cycles. Some tips for getting the best nutrition possible when you are having this side effect are some ways to make your grocery shopping and meal preparation easier. You can certainly participate in a grocery store pickup program or a home meal delivery program, such as Open Arms, asking family and friends to help prepare meals and shop for food and other things you need. We will be providing a supplement to this presentation talking about um, ready to eat foods that provide good nutrition and are also kind of a variety of different food groups, so that maybe relying on some frozen or canned fruits and vegetables, things like ready-made pasta sauce, microwave meals and side dishes. One of the benefits of meals of the type that Open Arms delivers is that we provide meals that are fully prepared and may just be bring out of your fridge and eat, or for the frozen meals, reheating those to eat those. So making it super easy and allowing for um, folks managing that illness to be conserving their energy. And on days when you do have more energy, consider trying to get some food cooked, a lot of portions of it, so that you can package it in smaller portions and in meal-sized portions and put it away to freeze so that you have those available when on those days when you are not feeling as well. Some other tips to manage fatigue is eating small meals or snacks throughout the day. So just trying to get that energy from food throughout the day, and this will come up as a common theme in our presentation. Trying to get a balanced diet, meaning foods from all your different food groups, from your proteins, your grains, fruits and vegetables, dairy. So just getting a well-rounded variety of foods. Staying hydrated is also really important with maintaining your energy levels overall. And if you can, incorporating some physical activity into your day, as well as getting good rest and good sleep as much as possible. Right. Our next side effect that we'll be talking about is loss of appetite. So this may be having no appetite or eating very little. You may or may not experience what the hunger cues that you're used to in cycles of, not eating and eating. You also may experience little or no interest in food. Um, and one recommendation that, again, will be uh, repeating throughout this presentation is eating several small meals and snacks throughout the day. I mentioned that you may not be experiencing those usual hunger cues, so you'll want to look at the clock instead of relying on your body's own cues to be eating meals or snacks at least every 2 to 4 hours consistently throughout the day. Um, for staying hydrated is important, but you'll want to You'll want to drink those liquids in between your meal opportunities so that at those meal times, at those snack times, you are getting the most caloric and nutrient benefit from those meal times. When you do have liquids, consider liquids that contribute calories. That may be beverages such as juice, milk, smoothies, or milkshakes. And otherwise, in general, looking to add high calorie, high protein foods and liquids to your diet. And we mentioned here keeping snacks nearby. At those opportunities when you're looking at the clock and it's time to have something to eat, you want to be able to use that energy for you you want to be able to use that energy toward eating and not necessarily having to move about and go to the place where that food is. So just keeping it close by, as you never know if you might have a moment where you're feeling hungry or it's a good opportunity to get a snack. For many people, eating soft, cool, or frozen foods can be more appealing and more appetizing, as well as just having those reliable favorite foods available to enjoy. And that's the kind of food that it looks good, it smells good, it tastes good, and you know that it's something that you'll be excited to eat. Um, and when you do feel hungry, eat a larger meal so that you are sort of taking advantage of that opportunity when your appetite is a little bit higher than maybe it may be otherwise. Another point I want to touch on is making those eating occasions more enjoyable. That may be setting the table, putting on some pleasant music, putting out your nice dishes. Also, sometimes distraction is nice by having family or friends join you for that meal, or if you enjoy eating in front of the TV, just so it's a more relaxing and enjoyable experience overall. And physical activity is something that, if you're able to incorporate that into your day, it can help promote appetite. We'll touch on here some high calorie, high protein foods and liquids. So we have our nut and our nut butters, like peanut butter. You can have oatmeal, put that into oatmeal, or have a PB&J sandwich. It's good to have some beans available to add to your soups and casseroles. Sometimes liquid nutrition shakes like your Boost or Ensure can be helpful. If you're eating dairy, you do want to focus on those calorie dense whole milk dairy sources. So no need for low fat or reduced fat if you're trying to make the most of your food and getting calories from that food. For a lot of people, smoothies are something that's easy to drink and a great way to pack in a lot of nutrition. You can use that whole milk or whole fat dairy to make your smoothie. And hard boiled eggs are something that's nice for a lot of people to keep in your fridge. And you can put those into your pasta salads or your casseroles. And then besides just having easy to drink, easy to eat foods, juice, milkshakes. Again, just trying to get some good nutrition from any foods or liquids that you consume. All right, we will talk next about mouth sores or throat sores. This may be small cuts or ulcers in the mouth or throat. Could also be swelling in the mouth or gums, or damage to lining of the throat or the mouth. This may be more common in cases where the cancer is located in the head, neck, or throat area, or where the the person is receiving radiation treatment to that area. The theme here is to find foods that are soothing to that area and will not irritate it. Um, so for many people, that may be colder foods. So think of your popsicles, ice cream, frozen fruit. Also foods that have moisture in them or are soft and just not as abrasive to the lining of your mouth or throat. If you do need to change the texture of any foods, you may benefit from mashing or pureeing foods or bringing those foods to that texture to be more soothing to the mouth and throat. Some foods to avoid that can cause irritation would be food that's hot, by which I mean um, maybe piping hot right out of the microwave or oven. So if you are heating up food, allow it a moment to cool because extra hot food can be especially irritating to that area. Avoid spicy foods like peppers or acidic foods like tomatoes if those irritate your mouth. Also, dry or hard food like crackers or plain toast can not have that moisture to be as soothing to the lining of your mouth and gums and throat. Um, and also think about eating small, frequent meals and snacks so that if from an eating occasion you're experiencing some discomfort, you're breaking those occasions up into smaller periods of time throughout the day. Some ideas for managing these sorts of mouth or throat sores. You may be able to use a straw to bypass sensitive areas to avoid those sore spots. Using a soft toothbrush instead of your regular bristle or harder bristle brush. And also, there are medicated mouthwashes that you might find to help with this, or also a baking soda rinse that you can use either throughout the day, but most importantly, before and after meals will help with soothing that area. Here we have some foods and beverages that can help with keeping that area soothed along the theme of foods that are moist, that have moisture in them, and avoiding foods that are dry, hard, and may irritate those areas or have um, spicy or acidic notes to them that can also irritate the lining of your mouth and that area. This is somewhat similar. Dry mouth may come about as one of the side effects of cancer treatment. This may be where you don't have a lot of saliva production, or the saliva that you do have is thicker and more viscous. That may change the taste of foods or how well you taste them. We'll talk about taste changes a little bit later. So, some tips to help with dry mouth are to aim for about 64 ounces of fluid daily, and that is more than just water. That may be, from soups or milkshakes, juice, or milk. So, thinking about aiming for 64 ounces of fluid uh, to help encourage saliva production. Chewing gum may help, or sucking on hard candy, especially candy that is tart or sour, helps with encouraging saliva a little bit more so. Also, for some peppermint candies, can also have that same effect. And again, just soothing that area and adding some moisture through frozen fruit popsicles and having ice chips available as well. Um, and yeah, another aspect to point out is that alcohol can dry out the mouth. So, if you can find alcohol free mouthwash to use, and also as a way to maintain dental care, because your saliva helps with your dentition, take care of your teeth and mouth. So, using mouthwash is a great way to take care of your teeth. Look for an alcohol free version. When you have dry mouth, that also affects your lips as well. So, soothing your lips with some balm or cocoa butter, Vaseline. Another idea that is beneficial if you're experiencing dry mouth is to have a cool mist humidifier, especially at night or in a room where you spend most of your time overnight or through the day, can help add some water vapor and some moisture to the air. Here are some ideas about foods to eat and foods that may be uh, less ideal when you're experiencing dry mouth. Similar to what we were speaking about before, looking for foods that have moisture in them, have liquid in them, and just help you get to that 64 or so ounces of fluid each day. Avoiding foods that may be more difficult when your saliva production is low or your saliva is a bit thicker in consistency. Next, we'll talk about problems chewing or swallowing. And this may be a result of different factors. It may be related to just how your teeth are doing in general. During your treatment, it may be where your dentures, if you have dentures, they're not fitting as well. Some of these problems may be able to be resolved by seeing a dentist and getting that dental care. And so those are some factors in problems chewing. There's also problems with swallowing that may occur, again, especially in that head, neck, throat area where the cancer is present or being targeted. Of course, the with swallowing issues, we want to lower the risk of choking or having things go down the wrong pipe. Some ideas with managing problems chewing or swallowing are, again, eating several small meals and snacks throughout the day, choosing foods that are easier to um, sound. They include, again, modifying the texture of that food. And this may be a one of those times where you may rely more heavily on the boost or ensure or some liquid nutrition to get the nutrients and the calories that you need and all the different vitamins and minerals. In cases where the swallowing problems are more severe, your doctor may refer you to a speech therapist or to make sure that you're getting the right texture of food. They may prescribe you a certain diet that is of a particular texture. Or in certain cases as well, it may be beneficial to have a feeding tube placed, and that will be directed by your doctor if, again, the problems with swallowing or eating in general are more severe. Um, right, we have a list here of some foods that may be directed by your care team if you're having problems chewing or swallowing, or maybe easier for you to chew or swallow. And it may vary from a thick pureed diet to just a softer diet, depending on those individual needs. And again, that may be a specialist that would give more particular information about what textures are working best for chewing or swallowing problems. And also, they speech therapist may also be able to provide some chewing or swallowing techniques to help with good nutrition and to avoid risk from choking and during that uh, managing that side effect. Next, we'll talk about managing changes in taste or smell. This may be where some foods have less taste or no taste, or on the other side of things, where certain flavors may stand out or be overpowering so that they're unpleasant. Um, and there's a couple different sides to this depending on what the changes look like. If where food is tasting bland or has very little taste, you may add stronger flavors to food than you're used to, whether with herbs or spices or marinating some of your foods to add additional flavor. Um, you may also be able to help with this by having sucking on some hard candies before meals. In some cases, red meat may have a metallic taste to it, in which case you can look to choose other proteins like fish or chicken. In some cases where that metallic taste may occur, that can be counterbalanced by adding some sweetness. For example, if you're having chicken, adding a balsamic glaze to it, or fish, adding a balsamic glaze, um, adding apples to your meal, or a little bit of maple syrup. Just a little bit of sweetness can help to counterbalance those unpleasant tastes if they occur. Sometimes food that is, if you think about when you get a hot meal or a warm meal out of the microwave or oven, all that steam that comes up, all those odors, if that is an overpowering experience or an unpleasant experience with that food odor, it may be helpful to have food that is at room temperature or cold. If you heat it up in the oven or microwave, leave it for a moment so that that steam can be a little bit more settled and won't be bringing the odors up as quickly. If you are able to open a window or turn on a fan, or we're still in the season, I think, where some days may work well here to eat outside. That can be another way to minimize any overpowering odors from food. Also, drinking through a straw can also be helpful for any taste changes. I mentioned before the metallic taste from red meat, or just that same kind of metallic taste sometimes can be experienced with metal silverware. So, eating with plastic utensils may be a way to decrease that. Also, brushing and rinsing your mouth often. Another way to combat this is to enjoy some diffusers or light a candle. Um, in many cases that I've heard from our clients, sometimes scents of lavender, peppermint, or ginger may be especially helpful to offset any unpleasant or any odors or tastes, so that you get that experience of scents that you enjoy. Of course, that's very individualized. All right. Nausea is a side effect that can be common with many types of treatments throughout one's cancer journey. It can be hard to predict. Episodes of nausea may last minutes, hours, or days for some. Even sometimes an empty stomach can cause nausea. So, mentioning it. Okay, sorry, I don't know what happened. Can you still hear me?
Yep, we can hear you.
Okay, sorry, my connection cut out. Apologies for that. Um, Let me just get back to where I was, and I will be moving through, and then we'll have, I believe, about 10 minutes for questions at the end if there are any. Okay. All right. All right. Oh, goodness. Okay. All right. Getting back to talking about tips for nausea. Some folks may have lesser nausea with cold or room temperature food, food that you generally find appealing. and choosing bland foods. Also, sucking on hard candy. Ginger is a spice, which is commonly known to help with nausea, and to avoid also then to avoid a completely empty stomach, which could bring on episodes of nausea, just even sipping fluids throughout the day. One tip that I will call out is breathing or deep meditation, especially around meal times, just to try to relax the senses and um, calm the stomach, calm the system around that meal time. Nausea is one of the side effects during cancer where there are some really beneficial medications available. So be sure to talk to your care team if you're experiencing nausea. They may be able to uh, help you with prescribing a medication to assist. With nausea, you want to focus on often bland foods, easy to digest, easy on the stomach. That may be some plain noodles or rice, or maybe some buttered noodles, potatoes, canned fruits, Jello or pudding. Just really simple foods that you know are are good for or that feel good and settle in your stomach easily. We'll also talk about vomiting or throwing up. One thing that's really important when those episodes occur is not to eat or drink the until that subsides. If you don't have anything in your stomach at that time, you may experience that kind of dry heaving. But once the vomiting stops, you can start with clear liquids that might be juice without pulp, broth, some herbal tea. If that feels all right, you can progress to full liquid foods and drinks. So that might be juice with pulp, some dairy products or milkshakes. Just something that still is easy on the stomach. If you find that you're sensitive to dairy, as may occur with a food sensitivity during cancer treatment, then avoid dairy, but otherwise they can make some full liquid foods and drinks that can help with progressing. And then, if full liquids are all right, move to easy to digest foods. So that may be, buttered toast or crackers, rice, pudding, something plain and simple. If you are experiencing vomiting, your care team may be able to prescribe medication to help with that. It's called antiemetic. So be sure to speak with your doctor if you are having that symptom where it's frequent or it's impacting your ability to eat. Um, so just a short listing of some clear liquid foods and full liquids. That may be also like pureed soups and vegetable juice, depending what you're able to tolerate and what feels good to your body at that time. All right, we'll talk about some GI symptoms, and so we're moving further down, so to speak. This may be more common with cancer or treatment that is targeted or located in the stomach, intestine, colon, pelvic area. This would be diarrhea, maybe loose or watery stools that may occur with or without out discomfort. Um, and if you do have a lot of diarrhea, it could result in dehydration, weight loss, poor appetite, and weakness. If you are having several episodes of diarrhea per day, or blood that you notice, or your stools are black, that is something that you want to quickly bring to the attention of your care team. Or, if you're not able to reach a care team member, it may require urgent care. Um, some tips to manage diarrhea. Generally, food and drinks at room temperature are better tolerated. Maintaining your hydration is very important. If you're having diarrhea, to replace those fluids. Um, as we mentioned with vomiting, where clear liquid diet can be a little bit easier on your system, and better tolerated if you're experiencing diarrhea, and then eating small amounts of those easy to digest foods. I mentioned that sensitivity to dairy may be an issue, but avoiding greasy or fried foods, as those can usually be more difficult to digest. Thinking about foods that are easy to digest, simple and straightforward. At the time you're having diarrhea, it may be best to limit the foods that you're eating with fiber until the diarrhea has improved or resolved. You will also, I'll take a moment here to mention that as part of this webinar series, you will be receiving a recipe book from Open Arms with some recipes to help with each of these side effects so that you'll have another tool in your toolkit. And we'll talk about constipation as well. This may sometimes be painful or uncomfortable where stools are hard, dry, or difficult to pass. It may also result in bloating or nausea. There may be constipation if the location of the tumor is within the intestine or colon or rectum area. Constipation also is a very common side effect of pain medication. So that may occur from taking pain medications. Also, sometimes constipation comes about when someone is taking medication for diarrhea and it actually swings. The pendulum, so to speak, swings back in the opposite direction where they are then experiencing constipation. If you do not have a bowel movement in 3 days, or again, if you are noticing blood in your stool, uh, that would definitely necessitate getting in touch with your care team right away and letting them know, or seeking care at that time. To help with constipation, we want to choose foods that are high in fiber. So we've been talking about a variety of foods here: our whole grains, our fruits, and our vegetables, as well as other food groups. So we want to find some foods that are high in fiber, maintain our hydration. With constipation, liquids that are hot or warm tend to help. Excuse me, with moving things along. And if you are having gas or bloating, there are some vegetables that, as they're digested, produce additional gas. Those are vegetables like cabbage, cauliflower, broccoli, beans. So perhaps avoiding those while you're experiencing constipation, as well as introducing additional air or gas into your system by way of carbonated drinks, chewing gum, or using straws. So avoiding those types of ways that gas can be introduced into your digestive tract. And with constipation as well, if you're able to incorporate physical activity, that also helps your system move things along. If you can be a little bit active, that also will help the constipation resolve. We have some high fiber foods, including fruits and vegetables. You'll get more of a fiber benefit from raw fruits and veg than you will for the cooked versions of those. And also some beans and nuts are in this list as well. And lastly, we'll talk about weight loss. Tracking your weight as you go through cancer treatment is very important. Um, Losing weight too quickly may cause um, or may create where you have a less responsive um, reaction to your treatment, or where your treatment may not be able to work as well. You may also experience lack of energy or weakness. Even if you don't have a scale at home or weigh yourself regularly, you may just notice how your clothes fit, or if folks who have dentures may notice if they lose a lot of weight that their dentures no longer fit. So tracking your weight and noting any significant changes or decreases in particular is really important. Some tips to help with weight loss mirror a lot of the tips that we've talked about today. Eating small meals and snacks throughout the day, looking at the clock instead of necessarily relying on your body's hunger cues. Choosing liquids and protein. Liquids that add calories and high protein foods. Um, Drinking fluids outside of meal times to get the most from those meal times, keeping your snacks nearby, enjoying the foods that you enjoy anytime, and eating more when you feel a bit hungry and a bit more well like eating. Here are our references for the presentation today, and we have an opportunity to, if anyone has any